Hi, welcome to Strength India. My name is Dr. Scott Dienison. I'm an OBGYN, women's healthcare advocate here in the US, and I'm going to talk to you about breast cancer prevention. Breast cancer is serious. Breast cancer accounts for 27% of all women's cancers. In fact, in the US, we have a rate of 1 in 8, meaning that 1 in 8 women I know will develop breast cancer lifetime. 1 in 8 moms, 1 in 8 wives, 1 in 8 daughters and sisters. The rate in India is lower, but unfortunately, the rate in India is increasing every year. The numbers are quite large. In 2012, 70,000 Indian women died of breast cancer. So, what can we do about it? There are preventable ways of dealing with breast cancer. Let's talk about some of the risk factors. What are the major risk factors for breast cancer? Well, number one is a family history of breast cancer. If a first-degree relative, which is a mother, sister, or daughter, has breast cancer, your risk for breast cancer doubles. Other things that can increase your risk is a family history of ovarian or colon cancer. Those cancers sometimes run in concert with breast cancers. Other things that can increase your chances for breast cancer is long-term hormone replacement therapy, alcohol consumption, obesity. All these things increase your risk for breast cancer. So what can we do to prevent breast cancers? Number one, maintaining a healthy weight. Women who are obese are twice as likely to develop breast cancer as women who are of normal weight. So it is important to have a healthy diet, low in carbohydrates, low in the bad fats, high in protein. Number two, exercise. Even a moderate amount of exercise will decrease the risk for breast cancer by 20%. High intensity exercise can reduce your risk of developing breast cancer by 33%. That means 1/3 less risk of breast cancer. Limiting alcohol intake. Women who drink alcohol are at a higher risk for breast cancer. Having children decreases your risk for breast cancer, especially if you have children under the age of 30. And in addition to that, if you breastfeed, your chances for breast cancer are much less, especially if you breastfeed for greater than 1 year. In fact, the studies show that breastfeeding every year decreases your risk by 4%. Again, powerful numbers there. So, to recap, things that you should be doing: maintaining a healthy weight, eating correctly, exercising, limiting alcohol, and breastfeeding. Those are things that can be done to decrease your risk for breast cancer. Early detection is, of course, paramount to the treatment for breast cancers. So things that you should be doing as well include a self-breast exam and self-breast awareness, making sure that if you feel a lump or if you're unsure if you feel a lump, you go seek medical help. Having a yearly breast exam is important by a physician or a nurse or nurse midwife. At age 40, you should be getting mammograms, and mammograms should be done yearly after age 40. Early detection and early treatment of breast cancer greatly improves outcomes and decreases deaths from breast cancer. So I'm Dr. Scott Dienison, a women's healthcare advocate here in the US, thanking Strength India for allowing me to discuss something that's very important for all of us, and that's breast cancer prevention. Thank you so much and have a great day.